Talvez sola malungil ko sa ngayon nagkitaro ko talbaran sa superstation ng WWFM solang kung eransisong wa lurior magkukna mo sel time at update ra COVID-19 ay giro ko il korapesel al dadu malo gantol gire la COVID-19 tungalan sa tungalan ng Minister of Health ra EOC MHHS EOC, yeah, that's how you say it. So lang at mo brief frigid ragi rogu chances may update frigid ragi rogu gid mo mangyar adar pelaw malwa se so lang malungil maututaw ngil ko sa ngay ngil afternoon and more tirgel ko nga different time zones lo mes sa social program especially tirgel nga rapi area ma San Francisco, Seattle, Washington, Denver, Colorado ngil ko sa ngay lagor view marubeng ngil maututaw direct mo ra East Coast ngil nga ra New York, Modula, New Jersey, tengal mera Florida ngil ko sa ngay lagor view and Honolulu, Hawaii. We don't forget about you, Saipan and Tinian, and also Ganya, Guam, Guahan. Ngil ko sa nga legor kumiw. Talo siya sola kultur kumiw, e kung alaan nung sa kafar uerbalaw, morong tigay girgit, ra tigit update ra COVID-19. Kafar.
Talo siya malungil, kapsingin mo ka tulig, wagil plamdung, malungil sil, sa mora rogul, los ilme joiner git al uktemela talk show. Agi brenga sule me tulig mar adara dias broadcasting agi direct brenga sule adang rel belahol malblo oil konge lobonget selbek temela talk show.
Okay.
Gi ayamare tulig wal kuram lo last minute la cancel ra talk show last week. Madingi lo semble November 11 mong wal Veterans Day silsra gidar veterans.
Okay.
Idi ayamal gidel se direct uktomer sergidra next Thursday direct Thanksgiving magadel kura direct akura mo gidel lolungul next week.
Okay.
Resume ra following week mong gidi ayamal gidel last week direct di OIS ra otherwise next week direct el bodolungul ng Thanksgiving mong gil el time el uktolungul ndi unless el sukum mong monya Clolor udels gidel المساعدة سيجيد السيلس of course هذا يقول نيت لو سيدبرا اير
anytime
ده قلت لي مغمان مساول again مال بتوقع updates since the last talk show مال بتوقع testing نام غتموك على سلا community ما direct قال سكوجيل ماي دي thankfully at time من سيد الوسن دي active cases maldir ka di 8 cumulative cases digayid il rogo na recovered alak palwidam le last el madang el case rigidam le tedera October 8 if I'm not mistaken since then ang waramal di ngila rogoy kada mringa sule adra bulu tulig raigal maral omrus ma direct na motelal outreach el morababal daw ang ayang mablilyo nagi direct mringa sule adra igel bulu no sabil mail me either the members malubtam le may participate regay the community testing so well over 700 la adam la test sila community since October dori the start community testing ra asahi Ballfield tama mamilmol metulig el continue gay the testing ma omrus ra kakaros el blue di sama melo ay sa madingil sing lam la to the press release el morgomir adra media ma direct nga raigal el social media page ra MHHS الوسائل لومروس الملاجيل ناريل الويك را السل اوريور ام لا cancelled or postponed rather كده البانغ تلقوك مرا الميل كمل دي لا يبدول بكده هم السيجي تديرك الموسبير سيل الجيم تو تنجي لو سين ناشونال جيم اب سنترال بادر جيد من دي من السمام لو تبدي سيجي دي tentatively وتوبدا atara schedule ko mo ay sa mga ngara ka resume ra omrus ra sel orior magidi ngit trabeklado sa dilbora sa gid el Facebook page ra Ministry ra Health ma Human Services direct di ranks ra igay el radio stations en to bada igel latest el schedule ra tokor omrus direct tulig el tokar adlogel gid la self Pfizer vaccine el mora pediatrics so 5 to 11 years old so mamlo ay sa kadam lamma baby doses have them on island and again ay gal qurab togol events albang mong gimogut muklat training ra huk radama mar omrus ese tulig huk ngod el file ngod el klungil orus sa dos peringin morarangal require kama trainer tirgal nurse tiramrus ra ay padal mo trainers lagi del lorus el morarangal lagi del ngitra coloring our parents di bolongi ra oya guril sub del mo ay sa ngara ka mo start del rus rangal gedel tirga 5 to 11 years old. Ese tuli ka Pfizer latta madi imol COVID-19 vaccine el blood authorized ngin mo tagi del age group. Di lakal within 1/3 or sel dose lolaring year muklolat way get tilung gerel lorus sa lobal morarangal kumung girel nga niyaman mo will training ra nurse gi mo tagi de mo ay sa adra bululo se mo ngrat tamel of the triar ngal girel se girel 5 to 11 years old. Ese tuligal adi mo sisiwa requirements ringi tirgal guk platorus til tigib muklolngal tirgal 12 to 17 mo require a parent lobangal kal membros o sisil time mo require sa gid lora consent mo gi olingit lwasil el al time lore sa parents lore ay gid lora documents el volospel o triangle gid merapat me gid melar orus tuliga Dr. Gidal Alcasus dengan tangat teleng sebela Dr. De La Cruz Dr. Bing guk me Gidal Alcasus imrenga sulen guk meskita abebira ulaklat kaya sisil time November 14 le World Diabetes Day asa edel guk koram sa teal mongora motlgibel el mut tel qora dio maklat kagid gidela okubila rakt el sukal wasa ba edem bru la time el aldir ka ngara sila pandemic ngara gel qora gidel guk matmok el malubo ka namrul gidela wala ka ruwila patagedem dakabodo تجد الرقط الدايابيتس. Thank you, Dr. Bing, for joining us again. But before that, tulig maningis kora namas kita abebir updates.
I see.
Di agumdaseng egal nomre kalerul Sunday dimla kata ngara talk show di guay selwase dirigel mlera last Sunday 117 narsel United flight tamle test negative ra airport sa May yamrot kada madangelo sa klugo katuguk mel melar sel day 5 test, so hopefully di mo ngilak robot to ra kluguk sel test.
Ang area question ngara so media lang ngara newspaper el girit tirgel melar sel tirgel 20 samel adel atra odel belum melar sko kim dara Macau May according to the newspaper tirgare lang confined to one particular area. Mangira action na government ra what course of action they going to take. Hindi question lang al kugoromil kire da COVID-19 as tirge komla move in and test it till make sure and diakal el carrier tagi del COVID-19 virus.
Ngoi se tulik so agel rokul ku requirements ra health. Gidil mok raw era nga sa skogil May ay giblem review mong tirokul 27 namle test negative submit agigid PCR negative test results yilara edel clubsera wera nga sa selsko gilmay sisil time tamle submit agil vaccine recorder tirm lo sa mamal review what approval was oy gagidia a fulfill agil book requirements ra entry requirements ra COVID egida madingila sa Untitled Chapter matagid weekly United flight sa lame ang anyar alamam mo report mo test tisel arrive mo tirigid 27 able the test report mo negative mo
digid rogul flight till coming in regardless akiri will perform say the testing was
adi mle ora exemption tulik semle flight tra Taiwan mle hook travel bubble tirigit tourist digit tel madingilo sa lamo diakas kogil mera el albuil mo diakas kogil at Taiwan may for the rest of the month and digit adimle ora exception or say the test report tirigel book narsel travel bubble hindi gagid rogul el charter matagid el weekly United flight ma directly gas kogil sold out sa lemeng total alamam mo tested this
la sel domestic lang cook tourism out of Korea lang Carl Guterres el former el senatore el former governor Kwame lang order lo Korean airline ma Jeju Air el most el create el البابل الكوك تلون لا كوريا متيار لان كوك جيرل سيد تلولم راي مي اكو مسن غاريا تبلول scheduled flight مالو بن charter flight المسويس برا December before Christmas اجي كوك جيرل
ويسه تولي كاي جيدل تايت ساقور ملا مدون hindi gidir ko riolo mentiri aku kadra tirgal partner agencies gidra immigration ma control ma biosecurity guk mo si angir sa gidel hotetele lagay gidel travel bubble flights ra guk Korea direct tulig la guk mornya TLL mornya guk revision lagay gidel entry requirements gidra sala December by the all listeners lo sel vol confirm del finalize guk pera atok show mo so this guk mo bes tetele la directive la mo tobdra sometime next month sila
etikita guk kora bi suggestion na halo se timing ra rogul talk show kami amo merbot ba rogul berde la information no la decide the prioritize la sen morgi maru bendia kami sabi utsugum na next week ngaringa atsungul la blur oreor solang e momesel bedula ikel bebira base na mos bedrulil mawdleokla asugu momesel lang community spread in control sola dia asmera blur balance will direct promise ngilo sesve del mora every other week mati mo yor kami nga I'm ready for any changes
moise tuli kaman sulang itilagi dia ko rabdas was ilal ko ra domestic existing tetele la rele dong ko ra malungil mang unless nguk mornya changes of course kada
I say
sige hindi sige ako ko ra mo tetele la ay del travel bubble flights ra Korea mo start next month magidil ko ra omes girel waseng man mo nga protocol guk mor sige del nga skogin nga Korean bay
okay tol mo
umdas hindi kay gid unless return nga niya
pia saldo ka di share at yale update ra sa ibal
kalabo
so starting Friday which is clue on November 19 ndira kalmo change sa travel protocols mo so isa brabalura sa ibal
I see
so tirigel adal nga rakwam mamarigel almura sa ibal amla modi al required al quarantine al sum fully vaccinated dalang okl nga al sila sa ibal labo lakiringi fully vaccinated ar other ngin
I see
ndira kalwa say tirigel fully vaccinated المصويس ادي al require al test upon arrival
I see
I see
kid la direct morti la guida del mesois someday soon en last que direct mo valor o el procedure I see
كده مقطعتها هذا دول وسندي على بالكورنتين سيل تسوار هذا الفولي فاكسينيتد like هذا المير بيلا دي فولي فاكسينيتد اما الميت ROM
I see
ROM and then a test day 5
okay
او ينديرق as long as يندير غارنيا pandemic worldwide يندير غارنيا cases ال pop up and la al dil mere at time that do away with completely modiaka testing malubang quarantine either a quarantine ra or a tester still so ay gida wal kora tools al those pe al navigator the pandemic
we take one step at a time
I say kodo mese ko mi ko gid o mese ngi adjust al mo applicable al mora bulul at so so ase direct kal sa ibala mo ay gid al vaccination cards abol honor way gid al vaccination cards rigida abol honor abulura sa ibal selbo the season this still ngari sa gid al online declaration form al malgira dal mo online filling 48 hours before the arrival abulura sa ibal
I see
and then our unvaccinated dir ka sabihin mo so yes bandit tadi continue quarantine or tier
I see
so ang segide and then ding gira dan mo madagel wase sel lultabdi abulura mrigel kaidan sa dir go remain al wase al tugu mandi ham adara mrigel mo so yes abulura mrigel ang gira mal fully vaccinated gira mal test so ay gaya di malamol mal
And in the meantime, may kita malmon practice again preventive measures, so I say, low mask, 6 feet distance, at the practice. Even though kung lang magil requirement of vaccinations, and di gira practice agigit just to be safe.
Why say, Dr. Tedros na WHO, akmal mula say, do it all.
Oh, okay.
Even if makam na vaccinated, still mura mask, still physical distance, o ay gero kuya gira dal loltirak.
I see. Okay.
Okay.
So lang itulig halip ko na di shell mula na ka telam ralas kuk share kuk gimlet tewang mula Denver endra last month tulig mal clone mo the traveler lang especially mura mainland clone mo erura ka na memo mura ural bonya pandemic Oy, arokul ata gidel lo mask mang teligibel ko tarigi kadim emergency dolong lelak kuam mahawain with it sigang al dangaras kogi o mask and unfortunately sa gidia bes new normal sugo mong anyar adal kura umdas mumraile direct odim transit mo through Hawaii and mura mainland and gidem register online direct ulaklat kal mura rokul adal tob der belaw mura lura marigel wase ko man mo ngilo mes sa gigit requirements and dakal way kamam lora kuam magi ng Okra food court airport dia kangaral gi mo tingi gi ko am temam board ito sing girin mo online mala ngarakkel mangarakkel gi pora Hawaii tulig ang direct kal malgora amasera da airport dakal tokol ata practice ay gigit social distancing mala ako at taligibel mo tukod al mortirgel adal makatatal dakal ngar umrail hindi Agim lamong dim na job mong sige di kada di practice ay gagit at preventive measures mga roy der gid as much as possible ako mo ragel de borngi we should be okay sige da ko koram le social sharing ilo sa tirgel mo omra dil bol korgi make sure I get roguil el balul bol through ri malub sel balul borngi al book like rogul requirements na wala lora.
Ya mama ko ram ngir kemer ngarba bladel es kini pigs kahale bo me mula sa ala ko mat ay gimos pa man mo. Kumiten na mo me dia ko mat kapser. Mang ela ka mam tel mut pok mamal mor omraen mora ko ma Miguel.
Malungil at tulig hindi sukum saygi da agiman mga lera adlo seb sukum diga lorus lora direct dia kadil to era am sabak kargak terrak tundi yagagi dia ba protocol bs travel la mo require vaccination
set percentage lang at sa ne monitoringin mo nari 1 mo nari 2 lamas mo nari 3% vaccinated the other vela wal open remain at 92
hindi akamal dir ngara 92 hindi sel gupodo mo tirgal murus tirgagi dem gagdel ngal ging angan yatta el talgibel mo riak kal morbab
I see
hopefully tidak kilsel ada numbers dito morbab hindi sa igid sa 92% tirgan lamay get tablo lorus malum sa igid imol Johnson and Johnson igid amal mol metulig el murus sel booster shot
I see
el resume padra orio regi ko tobdra asubal gili
mandir klar raw rengel kirela igid the difference between booster shot and third dose ay gigidre lang ta matelo no ra red rooster embro ko makauti tkangar ni makasahala mo rings yakso din mo tri taket tiamadel wa se makase oy kamlutus modi segid booster met gigidle additional dose
mo ise tulig melangel third dose ul mongede lorus adios isiu aklugel dios isiu dosage ringima suma atang ilo Moderna malung Pfizer yung dios ingelong edel lorus akmal dios isiu segil ay diesel el mortirgel adal lo spering gigid long edel dose mo wal lo isiu sel protection tir ma adal kuk ta karaktel ding ilat tablol dose segid ya mokterni so tirgigid tulwaset moderately more severely immunocompromised tigal malbora am itu the immune system tira ulus pers igid long edel dose
okay kami mo aisra se wai kamamre la kamam maldim le kota kingwa J3 ela kamamre la ki la motte mamle ko ko motte dia subda se tirgel mala Johnson am namo giril me ora ki mamle mrale ko okay
May se tuling belat time trigel kamiyul nila Johnson and Johnson sa namos min memelar sege del booster la sege del booster la time magdugo kundi tal Moderna do bang al Horus ending CDC am la ma FDA am la kumula sel sugum ngilo Johnson and Johnson del team la imolorus mengu tege del Moderna wal booster
hal mang Moderna ita se mera se Moderna malo Pfizer either or
may say
okay
Belar time rukuktia ka Johnson and Johnson na dola ma Pfizer tirigel mirus ra J3 sabihin may mga booster ng gagil Moderna.
Okay.
Itlil 2 months after sa gagil 1 dose sa Johnson and Johnson na atas may mga booster. Yung gagil booster tuli ka half ringgil original dose among Moderna hindi half sa gagil aklol kakakaroon sa third dose sa mga booster. A third dose, full dose, booster at the half for segidil.
Up until today, now, haringi kora negative side effect try gigidil booster, masel third dose ra Moderna marugan to Pfizer. Anya kora negative effects marugan kora side effect try gigidil additional shots lo kiwa booster marugan third additional dose.
So tulik nga director siya milara dultos medal dia sisi waigal side effects ra asira gimua ongero ma el third dose so ngwadim lo maring letel ul ima kal dalmlaringa orus ringi koramal din na dai chobersel day after hindi segi dal second day nga koram lom saulab dengek koram no swal maring laptelo maktimili mataylenol hydrate malima pokari malima chloral ma
I see.
Elang kita kafal buk ngilu yang kita le booster ringi mahal ito kari luas ng luang nga booster ringi.
Kamu ay sa kafal.
Dia kam direct lo sisi tulig ngilu ra sa Tuesday eli akora timne tai chobe bay el tuta pagi sa kora ngoram saula padengi ke kora mring lap telu ke kora sol mo iwol tel labsak ding se normal yang bulgulak mong Apatangnya ta o react al morong vaccine bulgulak mong urior. Hindi ra ata kakaro sa nganya ko kora mo dakal sal dakal filang ra man nganya ko mal kora mo osmer. Tingi maplan mo tret ng rangkel hindi usually hindi erung edel club sa mo
modelacho. Okay, ya kumagi mo malara ela kama rogo na DS broadcasting malara Johnson and Johnson melaki mo malara sa gidel booster wase
Waisay, oo. Tuloy dito ay salwasay hindi ka umrusra sila blue orior ending ngarngiya umrusra kapsangira kluwo ra 5 mo 8 kaya gingarangar along sa state office rangar along direct kal sabadong el sabadong luy el kapsangila buil gingar selget center el ngaray ra direct kal 5 o'clock kapsel mo 8 o'clock kapsay
sila tinibal pedal me manglasa aban
Paisay malngi dil adal swal me malara booster chatter ngi mal welcome sa garidal mere gay dil basyo alme ngi dil ngusay gidel vaccine card len direct kal mornya testing amang direct kal sa milme test ngwa a booster kamiu
elal sa babong wase
Paisay elalu ilgabsing ilabuil elal sabado nga murayray selget tester
Telak dong mo telak clock.
5 o'clock al mo 8 o'clock.
5 to 8 o'clock na Saturday. Target center ay dry mo siya.
Waisay.
Okay, we'll be there.
O si sita met tulig agolingit lo se hindi tirigel adal yilwa second dose tir February malugo March. Yagid ako mangira baby na orus el May hopefully sa yagid week after Thanksgiving yagid sa edal ko open mo tirigel yilwa ong erul Lorus ra April mo May. Tigibel ko rang song sa doses sa dola per la time hindi kami yung nila chay 3 matigero ko nila Moderna ra second dose ra February March agi mal lingit la sa email.
Okay.
Agi the booster. So sumgo mirus ra second dose ra am May malugon June mo takangal mangil antil ang October ta besel announcement sa namo sin me Memelara booster.
Hindi ko mil chay 3 as mil May. So yung le chay 3 adi after 2 months imla mo giri ulos pera booster.
Oy, okay. Yakma na meet tila.
Why say?
Okay, we're coming. Okay, 5 to 8 o'clock Saturday. Irai, why say? Get center. Well, thank
O sisita metuli ke tirigel rogul homebound ngilo se tirigel omsinder homebound ang ila J3 lakal bagi klagu ka adlo o rexetel tatla ora opte tirigel homebound lakal anda ka bagi klagi direct klom dasra mo plan lo se magrabo do mystery booster
house to house.
Oh, ada ka bol alwig hindi gi mo direct mo top dra sub lo se mo ngana gi mo marala ayel bli tirigel homebound mo mruserti se gi booster shot.
Okay. Well taken.
Adim lagi kita update sa tulik, wala ka question since edel book nga ulgoy ng masang Dr. Bing.
Okay. So thank you.
So thank you Dr. Bing for joining us again. You're always a popular guest on the talk show, so you can take it away.
Thank you for having me also. Good evening, Mr. Diaz, and to our dear listeners. Okay.
Right.
So as Gafar has mentioned, last November 14 was the International Diabetes Day. Okay. So, well, next week it will be Thanksgiving week. Okay, and after that it will be already December. So holidays are just around the corner, and of course, during those times, what do? There's lots of celebration going on, and we tend to eat a lot, and along with that, some would be drinking and smoking, and these can actually increase the risk for developing chronic diseases such as cardiovascular diseases, hypertension, and of course diabetes. Okay, so we'd like to spread the awareness about the importance of managing diabetes, and along with there's also a mental disorder that usually coexists with diabetes, which is depressive disorder. So, as we all know, diabetes is a serious problem, not just here in Palau, but around the world. It is a leading cause. In 2019, it's the 9th leading cause of death, with an estimated 1.5 million deaths directly caused by diabetes. So it is very important for us to know how to manage and to prevent having diabetes. So what are the risk factors? These are being overweight, having a high blood pressure, sedentary lifestyle, poor diet, and lifestyle habits. Okay, and of course, as we increase in age, it's also one of the risks. And of course, there's a biological cause also, which is a family history of diabetes. Okay? So we need to monitor our blood sugar, and as you know, diabetes is related to being obese and having an inactive lifestyle. So we should also watch our weight and hopefully know your body mass index, because having a normal weight helps us to prevent and delay developing diabetes. Okay? So we have to have the regular physical activity, and also avoid other in diet, we have to avoid those who are rich in sugar or fats, and also tobacco. Okay, because once diabetes sets in, then we have to really watch our blood sugar, because it could lead to complications. Okay, such as stroke, heart disease, peripheral vascular disease, eye disease like blindness. Okay, it is also a leading cause of kidney disease, and neuropathy and foot problems. Okay, so managing diabetes is not that easy. There are certain challenges that comes with it, and this can be depressing for most of the patients that are afflicted with this disease. So it's not uncommon for patients to develop a comorbid depressive disorder. Okay, and when a person has a comorbid depression, and that might also affect their functioning, because as you know, depression is one of the leading cause of disability around the world, especially if there are clinical symptoms involved and it has affected your functioning and caused distress in relationships. So having these two diseases in a person is really challenging, and we have to have early intervention and to be able to sustain the treatment for these two diseases. So it's very important for us to acknowledge this, because this has not been usually seen in practice. I mean, like determining if a patient with diabetes has depression and if a person with diabetes has depression, has the symptoms also of diabetes. And the thing is, especially with the diabetes type 2, the symptoms are not that obvious or severe as diabetes type 1, which is usually in the children and the young adults, young children. Okay? So usually when diagnosed with diabetes type 2, it's already late, or it might there might also be complications already, and that can be depressing to that patient. So it is important for us to be able to detect signs and symptoms early. Okay? So for diabetes, what we should watch out for are the symptoms of the 3 Ps, the polyphagia, meaning you're hungry, you're feeling hungry all the time. Okay, that's why you eat a lot. That's polyphagia. Then there's polydipsia, meaning you are thirsty and you drink a lot. And of course, when you drink a lot, then you tend to urinate a lot. So the next P would be the polyuria, wherein you have increased frequency of urination, daytime and nighttime. Okay, and of course, along with those symptoms, also you can have weight loss. Okay, and of course changes in vision. Okay, and other symptoms like erectile dysfunction. Okay, and neuropathic pathologies like having numbness on the extremities, because the thing with diabetes is that if there's elevated blood sugar over time, then it can lead to damage to nerves and the blood vessels. So,
okay, I got a question. You know, it has been reported from Congress. I heard, I was listening to their program, and they came up. One of the delegates came up with a statement like, in Palau, 1 out of every 5 citizens have diabetes, and they said it's very high for a population of 20,000 people. So, what do you think caused that problem? You know, having a high percentage of people here in Palau diabetic?
Well, I think it has something to do with one is denial, because diabetes is related to has a high correlation with being obese, and there's a lot of obese people. You know, and they're not really seeking treatment or because we have the necessary monitoring for blood sugar and skills to diagnose diabetes in our hospital. Okay, so especially now that there is a high incidence among the younger population, okay, young adults, there's been an increase in the incidence of diabetes because nowadays, one thing is about physically being inactive. Okay, so most of our children are into their gadgets. There's not much physical activity going on.
Right.
And if they are eating a lot, okay, not watching their diet, then chances are there's a risk for being obese.
Dr. Bing, I strongly believe that your health, or you are what you eat.
Yes.
You are what you eat, and the lifestyle of I just turned 72 years old, and I watch what I eat, and I monitor my myself to make sure that I don't get too diabetic. Let's say that at one time I was told that I'm on a borderline, so therefore I watch what I eat and how much I eat per meal. And I think at 72 I have not been told that I'm a diabetic. And now you mentioned different symptoms like urinate often and also want to drink water all the time. All those symptoms that you're talking about, I have not experienced, but they told me that if you drink a lot of water, that will clean your system. And I'm a gout, I have that problem. So I drink a lot of water, so I'll go use the bathroom lots of time, but that don't mean during the day, because my water consumption is very, very high.
Yes.
That don't mean that I'm a diabetic, right?
No, because you have gout, then you need to have increased drinking of water in order to pass out the uric crystals. Okay, that's why you need to drink a lot of water, and that's why you drink, you urinate more because of that. But it does not necessarily mean that you have diabetes, because there are other factors and symptoms that are related to diabetes. And very important thing is the monitoring of the blood sugar. Okay, because an elevated blood sugar is the thing that we're looking out for when it's the one that's used to diagnose diabetes.
But I can share with you this information because, like I said, I'm 72 years old, and when I remember those days where we walked like from my village here in Ngarmid all the way to Palau High School, or near that area, PCC area. We walk every day from Ngarmid to our elementary school in Koror, and then back to Ngarmid. We walk every day. And those days we didn't have any really cars that we can ride on, so we do a lot of walking. We do a lot of going to the jungle to get firewood, to cook our food. So there were a lot of physical activities we were doing those days, and we didn't have a basketball court, but we played baseball on the road, and stay active. And we didn't have really much money that make us can afford to buy a sweet and also high in fat, like hamburgers and stuff like that, So I think this new norm, we call it new norm, is to be blamed for this high percentage of Palawan citizens that are being diagnosed with diabetic, because I think our lifestyle, and now all of a sudden we have money and we can afford to eat those rich people food. Don't you think that's the cause of problems?
Yes, of course, partly. And the sedentary lifestyle, as we have pointed out. Like you said, there was a lot of physical activity that during your time, during your childhood.
Right.
Okay? So there's less people who might have developed obesity during that time, and of course the blood sugar might be controlled because of that.
Yeah.
And the thing is, when this point, the internet, okay, the information is quick, so the generation today, they have tend to, they have quick access to a lot of info. It does not require a lot of effort. Maybe before we used to go to the library to research, and that also entails going to and from the house, and also there's this immediate gratification that they have, so they get it from their gadgets, so it does not make them seek out other activities, outdoor activities that could have helped them with their, maintaining their physical health.
Yeah.
So they end up being overweight and later on being obese, and that's a big risk for developing diabetes.
I see.
And the thing is, there's also this what we call the body shaming, right? That's happening, that people who are fat might feel more depressed. So that also brings about this depressed feeling. And just like what I said, the coexistence of depression and diabetes can take its toll on the management and treatment of diabetes because of the lifestyle changes that has to be done. When someone is depressed, then they might have less effort in doing those lifestyle changes that could have helped them in treating and managing their diabetes.
Right, but you yourself, a doctor, so you know that depression, when a person is depressed, where are they going to go? They're going to drink alcohol, they're going to eat a lot, okay, and that will lead you into overweight, and when you're overweight, more likely you're going to be subject to, diabetic.
Yes, and it's not just diabetes, but also the other the chronic diseases like hypertension, cardiovascular disease, and this can all lead to stroke and heart attack. Okay, so there's an increased rate of death in those people with chronic diseases.
Okay, excuse me. Let me make this announcement. Good evening, and if you want to make a comment to Dr. Bing's statements or suggestions, please, you can call us at 488-4949 and either comment or ask questions, and then Dr. Bing will be able to answer your questions, okay? The number is 488-4949. Okay, let's go back to our program. Okay, back to you, Dr. Bing.
What else?
You make me scared.
Why?
Because, now I'm hungry, I haven't eaten. I'm afraid to go and eat my meal.
It's about eating a lot more than 3 meals a day, and there's the feeling of being hungry all the time, the feeling of being thirsty all the time, okay? Because of the too much sugar, and that's why you urinate a lot, because you have to pass out the excess sugar that you have. So those are the things that have to be considered. And of course, we have our time of meal each day, and the usual time that you have it, then you're supposed to feel hungry during that time. So if you haven't eaten, then it's a normal reaction if you're feeling hungry right now.
Yeah, I've known people over 30 years, they're diabetic, but they've been diabetic for over 30 years. Is that possible? Or, how did he do it?
Because we have medications for diabetes, and the important thing is to be able to control your blood sugar.
I see.
Okay, because like I said, if your diabetes is under not controlled, okay, then it can lead to damages in the nerves and the blood vessels, and that's why it could lead to blindness, the one we call diabetic retinopathy. Okay, so there's damage in the nerves and vessels of the eye, of the retina in the eye. Okay, and then kidney disease. Okay, so you can just imagine having a kidney disease that's gonna need dialysis. Okay?
Yeah.
So if the kidney is not able to get rid of the blood sugar and or other waste products of the body, then it can also affect the brain, and you can develop encephalopathy. That's why those who have increased very high blood sugar and decreased kidney function or a kidney disease, they can manifest with delirium, which some might interpret as having psychosis. Yes, but it's due to the defect of the kidney and uncontrolled diabetes.
Yeah. Dr. Bing, we have about 10 more minutes. Can I use maybe 3 to 4 minutes of your time to summarize what you have just said about diabetes?
Yes.
Okay. Dalawa siya sara malungil ko singa akti summarize ma timo melgor sel ma tugubet sen moktegara tegid diabetes asukal terrakta sukal. Ngagidere lang Dr. Bing melgol was being a diabetic tial sukal ra patengem kita matay kamlawa sukal mo lawyer sela ko bem il madik saran me sello met tial sugar en momul delta. Seguida dangerous tial selbo close sukal ra patengem tiares ema momul delta. Ya bon mul delta agel a heart tergang ari arteries malubing igel veins reportra sela patengem. Eso lang sulam dam lang mal gegrel diwa maklungela uy agel murdra sela madam ma direct heart tergaw ma kidney ka agel internal organs tergaw lang blood circulation let that oxygen nga patengem ma circulate to keep you alive. Masugum elang mom ting tial sugara patengem namoklo mamla mom ringer tial ras el circulate el mora osro imeng mas el men mora brain organ beteng el mora heart ma at ngela imam tial heart terga o mom per tial ras masugum gurul ere mom muldel ya bon muldel deng mom saig mal ube mo dia hat sal el bridge ra igel rat ngela o imma igel ra patengem el roid tial heart terga le heart terga o mom bertial ras el maliwe kertial entire el patengem mang kire merelan bogorgi kersel mula se o bom diabetic esolange en gartial ras a muldel ma bol muldel de tomar la madam tomar la kidney gaul heart attack gale en mot kaigal murd el maliwe kertial heart terga ngaria bebil go ke diwa maklungela gal iudel ngara mom rig tial ras mura se maliwe kertial patengem mang melga ul melgo Dr. Bingel was say gidere lang asugo mo sugal more likely the stroke kamlo mal obele le kan murder aptulim lang aras armur tial brain regal melel yuek le tial heart ga omom pringin mas aptulum metengel melmor o imma elsewhere masugo men dia kan teker gau es gospel sugar dim tergak dim mangang melima merkose emru la gel dia lungir tial tem engor dia kotelem. Okay, di seguida qadim summarize ring lo seguida. I hope you can understand al ngariya harmeu. Please mkolara 488 49 48 488 tabeng wargid. Okay, now back to Dr. Bing.
Okay, in diagnosing and screening those who are at high risk for diabetes, like I said, there's a high risk for a family history of diabetes. So those who have a history in their family should have themselves screened or checked by their doctors earlier.
I see.
Because by catching it early, then we can prevent or delay the incidence of the diabetes type 2.
So, in other words, you can inherit diabetes from your mother or father's side? You can.
Yes. Actually, there's even what we call the gestational diabetes.
I see.
This is the diabetes that the blood sugars rise during pregnancy. Okay, but they typically resolve after delivery. But during that time that the mother is diagnosed with gestational diabetes, there's increased risk for complications during pregnancy. And these mothers and their children are also at an increased risk for developing type 2 of diabetes.
I see.
Yeah.
Okay. Did I say written kam gora kakargira dalong lilwa sengarnya gora plek interpret el dia sal wa say am correct nga asumak ne mistake. God him le dacho.
Is that it, Dr. B?
Yeah, so, just like what I said, it is important for us to be able to detect symptoms of diabetes and, of course, the symptoms for depression.
Yeah.
Because by treating them early, especially in those persons with having those two diseases as comorbidities, then the better management and the treatment and that we can provide them, and it is available in Palau. So for those who are experiencing depressive symptoms, okay, you can call our BH outpatient department for schedule. It's 488-1907. Okay.
Okay.
And
Dr. Bing, can we get this phone call?
Okay.
Ali ngil ko sangay?
Ali malu ilgap singe tulik.
Oy.
Tulik kadim gerira toktangal. Ali di kuwai setial teletele. Tulik nga kam lang alak targi gara okoluma.
Oy.
Lam lamurnya edera. Edera kadim laksal mlima koi mamergos.
Oy.
Hindi elak kora man na musakal mlima setial. Koi makora mergos hidum blo.
Oy.
Di regal wal kora diakal lumina aliwe kaklool. El silpagi se raktor sei, rakpagi se murabensi, ang ramong hindi nakkway sei. Kita gupi meta silpagi sak mga di elat yan na mubekil se, el kumakarang girikal murabensi. Bulbulak mula se am na musukal.
Amalungir niyo bara toktang? Oo, just lo labalay the symptoms you are or you're not. Malungir ringi lang asuma irregularities regard lang kam namo tribe suspect ringi plus giren mo mtengel wase arki maloral mo makamral mo o so ispera I like it malungir ringi my advice ang halat ko kay Dr. Bing and dinga ha ko sa say asuma ngariya gel gora question about lang symptoms lambeso ispera batenge malungir ringi obra check up el dimrede so la to wise regard malbred. Okay, Dr. Bing, here's the question. The guy is experiencing some symptoms that before they were not there. Okay? I told him, my advice to him, I told him that, it's best that you go and see your doctor and they'll run a physical test on you and see, if you have a problem. Was that okay?
Yes, because like what I said, blood sugar levels is the one that is being used to determine to diagnose a person with diabetes.
I see.
And the symptoms, they may be of diabetes or maybe of another disease, or depending on their, lifestyle.
Okay. So we got about 4 more minutes to go, and if you guys want to sign off for now, the line is on you. Dimlegi kita kora sodal discuss katpar.
Jangan kita adol langan niya sol.
Okay.
Nakapsulan niya tulig mal kam leungil sele example kartel ras algramo muldel iso adalo maklat kung masente kaldil sugal donganging mo akadamo sa edal mo sugal mo diabetes. Dr. Bing, it's not just sweets, right? It's excess food, fats, and all unhealthy food that can contribute to obesity and diabetes, right? Not just in Palau, you say sugal is diabetes, so you tend to think only when you eat sweet food. So, but it's not just that. It's excessive food and other unhealthy food.
Diabetes is not caused by sugar, okay?
Right.
It's about the impaired ability of the insulin to decrease blood sugar, okay? And if there's, for the type 1, the body does not produce insulin because the insulin is the one that lowers the blood sugar. Okay, so when we eat a lot, okay, so it's not just the sugar but also the cholesterol, okay, that must be considered, and the triglycerides, okay, and when we are stressed also, that also increases the blood sugar. Okay.
I see.
And when that happens, when it's happening for a long time already, it can lead to damage to some of the body systems because of the damage to the nerves and the blood vessels.
Yeah, I'm kind of confused now sometimes when I was in the military, like when we do a training, during the training we kind of losing our strength, and then they give us something sweet because they say sweets consist of so many percent calories, and calories will boost up your physical body, strength. So they give us sweet, or if you want to keep sweat controlled, they give us a salt tablet, to retain your sweat, so it doesn't, because we don't want to get dehydrated. So they give us a salt tablet to hold that sweat within our body, so we don't dehydrate. And they give us sweet to boost up our strength and also the physical body. Is that correct, or am I being wrong?
Yes, because if you are having a strenuous physical activity, we wouldn't want for you to develop hypoglycemia, which is the decreased blood sugar. Okay, because having decreased blood sugar can make you feel weak, and extremely low blood sugar can also develop other symptoms such as having delirium and having confusion, and that's why some who are diabetic, when they develop hypoglycemia because of their strict diet or they do not eat at the proper time, they might develop hypoglycemia, and that's one of the things that we should watch out for, because it can also have an adverse effect and can also lead to having complications.
I see.
One of those is they might be having delirium, which might also be construed as having psychosis. Okay.
Diwan. Tuli ka mangaring announcement ka ma'am.
Oo.
So tel masata kay gidel raktel wa sugal ma high blood ma carcinoma. Ngaringi sel udo del lut tabdiyar other olbira kalulaw del NCD fund NCD funds lel te longra ringi triyegi del committee National Coordinating Mechanism for NCDs. So tamla Ministry of Health and Human Services providers sa del administrative support del more sa del committee. Obisra NCD ma prevention unit malaya applications el mo fundang del project malupeng gora program rabalu el niya olsnak lay del rak del NCD.
Okay.
Teng mrulaw rio el niya amo sob a cliff gora ol nga sergi dra ungil tetele laklangar el niya mo prevent ay del rak. Mangarniya sa level apply ra 5,000 mora gora magikarel project malupeng 25,000. Sila one organization na sabel either yung apply ra 5,000 malupeng 25,000.
Okay.
Application sa sabi edel may almutel ko makalom so edel sa edel may ra tel office ra NCD nga ra PCC. Malubeng office ra prevention unit tel nga ra VIP building sel nga bitar sel muud del United Airlines office.
Okay. Kagamit ka telgibel was modil ko ra mo takran dira tokla. Okay. Let's say nga ka makaparal adar ng remede ki ngot titirar boy ng remede mot makem mergoro lia programmer gamamel girela togora NCD ngigelo asig mo mga sarap trula ara amaang esorang mo O ya kalama next year ang igagid may gagidil ka laging gagidil ko ra expectations ra tegil to ko ra NCD lang amo part ra program mas amal apply up to $20,000 in support that tegil to ko ra NCD kamama mot mageruli senso eder polwase
Sabele tuli kandi al sumong kumkukti ndi imo maluba kumkukti ko makafar nda kalsal sabel ngirel let's say yudra ngaramit ang ngara yudra ngaramit ang kafar ang yudra ngaramit el establish el gimodiyek masya kom yudra ngaramit
okay
kom al dabel ra ngaramit el sabel malubeng ngidil not for profit that kalsal mora businesses non-government, not-for-profit, malubeng government office, sabel apply ringil mora wato ko health promotion al sugum kaso milsal sa exercise ra mirabulu ra army dalubeng ngora ser ra army away gigidel ngora setele la uriora sabel galudo del mom oitringi
mas amal luasa project di mo ringi amo malamot marata ora ulariu eso la nusa gil di tele presenter seguir the request wa mal mora NCD tir o mesra purpose ringi ma involvement tra se truata ang tela di sirar ade mergomo funding lo ya gil de ludo tra NCD why say okay ali application sa tura December 3rd 2021 ngaringi letablong a workshop sa El Almandra November imora workshop palgibo moruring yakluguk ra West Plaza ra 8 telmo 11 irar adal mera kluguk ogera questions sa gimo present the information al gila legal gidal applications maigel nya tetele la urior sa amal fund ogore ol ngasero kami ay gidal tayidal omoruring ilgora ogera nga kalmasay kang sabel yeyida kuk sa amal mo sugumira royal das maangi dilata sabel el may ndakal ngi dilatang al sumo kom tera kora al malubeng obis sa government en sabi will mo kat adu may magi mo sugumira gidal application sa min okay gira del mo organization rablu el de kala at least sesel adrablu ya project el pomoruringi atgol blue kirela blue ra wa ngarbiden gora program el mo melmot magdamangat sara al duk lang agigid lang o promote lo yakte dito gora NCD
moise
to dire lo se ngara mo goliu mo swelber gmi mas kama malista gels mo ngara selbo gimo swelbo
malwaise tuli galing hasta ko mga smokla to ra exercise mga rang di ma marang public health amal di malgol masesel ko morura sara to koy yo ko mo tapker di ungil mong kya kam exercise me mo nga gay ko marang al tugo mong gay yung giren malgora di tel give en yaklo yasay ma fruits so ay gida mo tretele la urior mong radra blu oba ding warang kal segi del 775 1138
okay
direktal nga niya kazirin sa biil ko lang nga
tahal tung tal gole ali ungil kabasngay
oy tulik manuil kabasngay ma ulo ko na program di mga nga interest trigger sa roger kay imo to koy
kabo
agay na ko ra ka farma amra hospital tiga nga kon plan awat yagir iskogik tilong nga kabunyan berbelaw ngaring tilgele du marngel aved
ay
ngarngi pero ang status niya gora amra gisel wasing kunden kuita babilie merveraw
ndia kahala pa
iselem dia
kamle meod el gol tilata amle gol tilgimo sader ngi yak na ogertir et mula se sel partra public health de chega lo aset tirgang tasme te dia sel part el guk tira ora ngi semil kat mok matirge cleared ya guk to ora wala ibor mangaranga ki guk ngalela office ra labor ma
ndi andi ang mabang sulang tulik
okay
upila hospital kom sulang akmal akmal milgise
okay
okay
oi bye o se moise edolmo
moise
oi no gid mili web no meudel ndi nesan mo tnge at least aknas modil morgi okay dim lege gid edolmo
oi dim lege gid mal mesaule
okay mandiame mal mesu bugo e ka pare poto ko bi makuk next week ndia next week ndia kanut mo taklisa next week ndia albornia show unless ngaringia mal important information el director del Morapuay moise
moise tuli ka gidi ayama lo se do edo lingita atrablu lo se do lungul next week lengora Thanksgiving itself
ay
mal sugo mendia akora or udel gida del mo masad edo lungul next week masel guk December 2 the resume ra talk show again
okay gora malungil
Ay, madalway sa tulig man sulang kiti mo reng ramal lungil Thanksgiving in advance and more beklat. Makuk next the better talk show.
Okay, may igarogoy. Bye-bye now. Have a nice evening. Okay.
Mo me sa balwa